Good morning, and thank you for attending today. My name is Captain Chris Kolensky, and I'm the commander of the Emergency Management and Homeland Security Division of the Michigan State Police. Today is a 22nd full day after Governor Snyder's emergency declaration for Flint, and many efforts have occurred during this time to ensure the residents of Flint have the safe water resources that they need. In the short term, our primary mission continues to be ensuring all Flint residents have access to water filters, bottled water, replacement cartridges, and testing kits, water testing kits. Since January 9th, we have used both door-to-door water response teams and water resource sites at the city's fire stations to distribute 186,309 cases of water, 94,301 water filters, and 29,841 water testing kits. In addition to donations we have received, the state of Michigan has purchased over 145,000 cases of water, 154,000 water filters, and 62,700 water testing kits. As we move into the next phase of our response efforts, door-to-door efforts will continue, but these will become increasingly targeted to ensure we are reaching every single home. We will also continue to operate 5 water resource sites staffed by Michigan National Guard soldiers daily from 9 a.m. to 9 p.m. to provide free bottled water, filters, replacement cartridges, and water testing kits. Water testing kits can also be dropped off at these sites, and 3 of the 5 sites now also accept empty water bottles for recycling. Our message to the residents of Flint is that we know that our job is not done, and we're committing to do what it takes for as long as it takes until this emergency is resolved. We will continue to bring all state resources to bear, and we will pursue any and all federal resources that can assist us in protecting public health and safety here in Flint, in both the short term and the long term. If you are a Flint resident and you need help, please call 211 or visit www.michigan.gov/Flint Water for more information. Persons wishing to assist with response efforts are encouraged to visit www.helpforflint.com, all spelled out, to learn more. At this time, I'd like to introduce Governor Rick Snyder.
Well, thank you, Captain, and I appreciate that update. I want to thank the Mayor for her partnership and for hosting us here today at City Hall. This is about working together to address this issue. Last week in my State of the State, I gave history, I apologized, I talked about the background of all this. This is about continuing to take action, though. Now is the time to act, to do things to help the people of Flint address the damage that's been done, both in the short term, the intermediate term, and the long term, and I'm committed to getting that done. And I appreciate the Captain and all his efforts to go through the summary of a number of the facts that have taken place recently. Today, though, I'd also like to announce a series of other actions that are part of the process to get Flint on a more and more positive track each and every day. To begin with, I want to announce that we're going to increase both the executive office presence and the presence of the state of Michigan and the city of Flint in terms of physical presence. So we'll be opening an office here at the state office building headed by Rich Baird. Rich is with us today. Rich is a Flint native. So this place is near and dear to his heart. He's done tremendously good work previously in our administration, particularly in helping the city of Detroit. So he's going to be our point person here in Flint. Joining him will be a number of other people, including the Lieutenant Governor, spending a significant amount of time here. Again, I'll continue my presence here. Harvey Hollins has done good work for an extended period of time in this community, and that will continue. But you'll find many other departments bringing resources and people to bear on the ground here to do things to help the people of Flint. One of the activity centers for that will be the Flint Water Interagency Coordinating Council. I established that by executive order earlier. We're having our first meeting today. I will be present at that meeting. It's really a group of state officials with city officials, county officials, and outside experts. People including Mark Edwards, Dr. Mona Hana-Atisha, other experts. Lawrence Reynolds, I believe, is part of the team. So we've got a great group of experts. We're also inviting federal officials to participate. Again, this is like, let's bring all resources to the table so we can do this in a coordinated fashion. And that will be one of our primary instruments to move forward in terms of taking more action to help the citizens of Flint. In terms of other issues, one of the requests that we just announced yesterday that Nick Lyon will be speaking to, our Director of Health and Human Services, for making a request to the federal government to expand Medicaid to children under 21. Also look at how we can apply more lead abatement programs to help those children, and also looked at more community-based programs, medical home models on what we can do with children that may already have other forms of health care coverage. We're putting in a request to the Small Business Administration about how we can look at low-interest loans and things to help the business owners of Flint get through this difficult time, and then hopefully have an opportunity to have their business grow and do better in the city of Flint. With respect to the Flint Water Task Force, a group I established back in October of last year, an independent group to give recommendations to look at the background and history of this whole event and talk about lessons learned. In a couple of other occasions, they had made recommendations. We followed up on those promptly. They gave me a letter last week. I'm responding to that letter in terms of yesterday or today. My response is going out, and I appreciate the recommendations. We'll be incorporating those, and Director Cray will be talking about that in terms of how we're incorporating those recommendations to look at the question of water quality and water safety. We'll establish a separate group of independent experts to work with us on the question of how do we get the water turned back on at the tap so it can be safe and clear, and what testing should be involved in that process to get to that point. In addition, I want to thank the Mission Council Foundations. They've provided some grant resources to help the city in terms of Mark Edwards. So there's a number of steps we're taking, but this is just the beginning. This is not the end of the process at all. So I'm pleased to say the Senate should be taking up the $28 million supplemental request for additional resources in Flint today and tomorrow in some fashion. The House passed it very quickly, and with 106-0 as the vote last week. So progress is happening there, but this is the start of a longer-term process to make sure we are committed to Flint. So if you do not look at this press conference as the end of something, this is just, again, another stopping point to say more is getting done, we're going to keep doing more, and we're going to keep committed to the people of Flint. With that, let me turn it over to the Mayor. Mayor, thank you.
Thank you. I have just a few announcements that I want to make. First off is that Virginia Tech scientist Dr. Mark Edwards has been retained by the City of Flint to oversee all water testing done by the state and the federal government. He is fully independent. He will be reporting to me and is funded by private donations. Secondly, I have told the Governor Snyder that Flint residents should not have to pay for water they did not and are not using. Therefore, he has set aside $3 million in his supplemental budget request to legislators to address the issue. There's more work to be done once we have accurate numbers from the Flint Water Department, and we will revisit what is right for our citizens here in the city of Flint. I want everybody to know, I appreciate the federal government stepping up, but this does not replace the state stepping up and giving the funds for our residents to fix this issue. I'm going to have Mr. Craig step up. Thank you.
Thank you, Mayor. I'm Keith Craig, I'm the Director of the Department of Environmental Quality. So I'd like to just take a couple minutes today to tell you what the Department of Environmental Quality has been up to. First, we do work in lockstep with our federal partners. So there's a weekly conference call actually between the director and the interim regional administrator to make sure that we are on the same page. We're actually in the homes with EPA and HHS for that matter this past weekend, looking at water quality, water parameters, and making sure that that is right. Thirdly, the water treatment plant and their distribution system, they're doing weekly sampling for water quality parameters and lead. Next, we actually have a 5-point plan relative to water and water testing. As you know, we have residential testing that's occurring right now. There's 2,577 samples that have been sent in. They're not statistically valid, but we can say that things are trending better. 160 of those samples were above 15 parts per billion. So the vast majority, 93.7%, were below 15 parts per billion. 85% were below 5 parts per billion. So we'll continue the residential testing. That's one. Two is we're doing the food service testing. So we're going into all the food service establishments and working with our friends at the Michigan Department of Ag and Rural Development and making sure that the water in those establishments meet standards, production standards, food safety standards. We're also doing the schools as we've announced before, 13 schools. We've been through those. And so we can expedite that, we're working with our friends at the Department of Licensing and Regulation, and we're just replacing fixtures. Then we'll go back in and test those. 4 is we're working with our friends at Health and Human Services, making sure that we're paying attention to any of the elevated blood levels and then looking at water as a source. And so then as we move down that road, and then 5th is we're in the process of establishing sentinel sites across the city that are geographically represented. And we'll do that in consort with the new committee that was just stood up so that we get the experts in the room so there's agreement. No longer is there a difference of opinion between those that actually identified this problem and those that were denying the problem. So we are on the same page, and we'll make sure we're on the same page. And we'll make sure that an interagency group looks at that, because there is no excuse. Flint residents deserve safe, high-quality drinking water, and that's a long-term commitment. So once we establish sentinel sites, we'll figure out to see if the increased phosphate additions to the water is actually putting down that protective barrier, and we'll do it on data. And we'll make sure the data is accurate, vetted, and transparent. And I should say that any homeowner that's put in a sample can go to michigan.gov Flint Water and get the results immediately. Upon the results, there is no longer a lag in that, so you can go online and get your results. And then lastly, as I'm working with EPA, there is the commitment to make sure as the city transfers to KWA that we get it right. And that's a thorough review of the system to make sure this never happens again. We'll make sure the engineers, the healthcare professionals, and the water quality specialists all sign off and agree to the end result. So thank you. With that, I'd like to introduce Director Nick Lyons.
Thank you, Director Cray. My name is Nick Lyon. I'm the Director for the Michigan Department of Health and Human Services. I'd like to give an update on some of the activities and also describe in a bit of detail some of our conversations with the federal government around some of the programs we're looking at to provide primary care and behavioral health services in the future for the children of Flint. We are going to ask the federal government that we expand Medicaid eligibility to all individuals under the age of 21 in the city of Flint. A big piece of that request will also be asking the Center for Medicare and Medicaid Services, the United States Department of Health and Human Services, for their consideration in providing Medicaid match for the abatement of certain homes, especially those that are impacted by water. This will be a big step, but it will also stretch our resources to help the city. Most importantly, and I think long-term for the city of Flint, this is really about providing targeted case management, wraparound services, ensuring that children have access to a primary care physician, that they're connected to a primary care physician, that they have a medical home, and they're seeking and receiving the health care they get. As Governor Snyder noted, this is a long-term plan. This is the beginning. And from a health perspective, that couldn't be more true. We know that lead can have impacts for years to come. And we're working with our local partners here, the Genesee Health System and the Genesee County Health Department, to determine what tracks, what activities, and what services need to be provided to ensure that the children get the best chance they have at being successful. We're also working with the United States Department of Agriculture on expanding educational and nutrition services that are provided currently through the WIC program to families and children ages 5 to 10. That's something that we're working with them, and we hope to have an answer from them soon. Again, I'd like to reiterate, this is a first step. We have a short-term plan to address the immediate issues around having safe water. We have intermediate changes plans as well. We're looking at food safety and security, and long-term, what can we do to ensure that children are receiving the behavioral health services they need. Thank you. And with that, I turn it back over to Governor Snyder.
Thank you, Nick. And I'll see if Dave wants to direct questions my way.
Sure. Because we're live streaming, we'll leave the microphone to ask the questions. We'll hand it out. Please hand it back when you're done.
We'll start with
Governor Snyder, I'm Adriana Diaz with CBS News. It's estimated that it will cost $100 million to replace all the lead service lines in the city. Where is that money going to come from, and when is the soonest that one of those lines will be replaced?
Yeah, what I would say is a lot of work is being done to even understand where the lead service lines fully are. So I would say any numbers you're hearing at this point are still speculation. Part of the research that would be done in the next phase is to really fully understand where there are lead service lines within the system. And then that calculation can be made. The short-term issue is about recoating the pipes. And again, that will be based on third-party experts saying the water's safe. Because our goal is to get the water coming out of the tap safe as soon as possible. So the short-term solution is to hopefully recoat, have it validated by third parties in addition to government officials, so we know the water's safely coming out. That's what Director Cray was talking about. In longer term, we are doing this mapping to look at the infrastructure issues, where the lead pipes are, and how to prioritize looking at the issues of replacement.
And longer term, is the plan to replace all the lead pipes?
Well, again, that's one of the issues we have to look at statewide, and that's a national issue, is there are lead pipes in many places, and you have to come up with the proper priorities in terms of how to replace that infrastructure.
Again, we'll use the microphone for follow-up, so give it back. Charlie.
Thank you. Governor, there's a lawsuit filed this morning that says allegedly that MDEQ has not complied with federal testing and monitoring standards. Your comment, and are you planning on going to Congress?
Well, again, I'm not going to speak on a matter of litigation. There are a number of lawsuits that have been filed, Charlie. Our focus now is taking care of the citizens of Flint. We'll properly answer any lawsuit filed, but let's take care of the people of Flint about making sure they short-term have bottled water, filters, everything else they need, and then how do we get good water coming out of the tap, and then how do we rebuild the community? With respect to going to Congress, to my knowledge, I haven't been invited to go to Congress at this point.
Drew?
Drew Moore with NBC 25. Director Cray, maybe you can answer this, Governor, as well. A lot of very vague answers on when people might be able to turn the tap back on. I mean, these people have to drink water bottles every day. I mean, is this a matter of you're setting up the Sentinel signs? I mean, are we talking about months? Are we talking about a year project? Are we talking about maybe next week? Like, can you narrow down the scope for the people out there that are wondering when this, they can return to some sort of a normal life?
Yeah, what I would say is the most important thing is not based on chronology. It's based on having good test results that show it's safe. So in terms of giving a specific date, the answer is no. The other part that we are going through this process, that there is a lot of good discussion going on, and I hope we can get an answer to you in terms of sharing the protocols about how many tests, how many places, how long each test cycle will be. That's something I would hope in the next few days we can get resolved. But again, this is where we want to do it in conjunction with all our partners, both local and federal and outside experts. And so those meetings are actually some of those meetings are taking place even today.
Director Craig, can you talk on where the testing is right now and what you're seeing from the results? I'm sure the office at this point is seeing something. Can you share with what you're seeing and how much more work you have to do before you get the all clear?
Yes. Well, as the governor says, the all clear will be an all clear that's a consensus all clear. So it won't be the Department of Environmental Quality and or the city in and of ourselves giving the all clear. So just to be clear on that. And as I mentioned in my comments, as we're seeing samples come in, and these are samples that are provided by homeowners. So I can't guarantee that it's a lead service line. I can't guarantee what side the filter it's on. I can't guarantee it's a first draw. So that's why I'm very hesitant to say the trends. But at this point in time, 93.7% are below 15 parts per are below 15 parts per billion. Yes, 85% are below 5 parts per billion. And those of you that have studied the lead-copper rule, those two numbers have some significance.
Is it safe to say at this point it's going to be months before any movement is made on that front with the residents?
I think what's safe to say is that there are areas of this city, so there's not lead in the water that's coming from DWSD. Everyone's clear of that, right? There's a 30-year history of Flint getting water from DWSD that had lead at around 2 parts per billion. That's where the water's coming from now. Now we need to figure out, as the governor said, is there a protective barrier being laid down by the increased phosphates, yes or no? You do that through data collection and analysis. You do that with looking at third parties and making sure, as I've said before this group, we're not going to guess. We're going to assure that people in this city get safe, clean drinking water. There are areas that do not have lead service lines. We should be able to figure out through sentinel sampling in a relatively short amount of time that we can clear some neighborhoods. And that's our commitment, is to put together a methodical, defensible, and reasonable or rational plan. Thank you.
Thank you, Director. We're going to go to Kyle. Now I'm going to try to get to the back of the room. We've got a clear path.
Governor Kyle Felcher with the Washington Examiner. A lot of people from around the country, critics and pundits, are calling this entire situation a kind of indictment of your style of governance. Has this made you reconsider how you govern at all? Or is this kind of, do you see this as an aberration type of situation?
Well, again, if you looked at it, Michigan was a broken state. We've done many, many good things. But this is a case where there's a failure, in particular in the Department of Environmental Quality. Those folk work for me, so I am responsible for that, and I take that responsibility. But as a practical matter, and we're going to continue to look for that, but there are 47,000 other good, hardworking people in state government that are doing good work, that have done many great things for people. So I don't want all that to get lost in terms of many hardworking people that are in, government service. We had a particular problem. We're addressing that. It had huge consequences, though. And so you learn from these lessons. So I have learned a lot, never to take anything for granted. Hopefully I didn't before, but this just reinforces that. And so I'm focused on the solution here. We are going to address this problem, and I'm committed to doing that.
Governor, in the back of the room here.
Dana Maloney with ABC 12 here in Flint. We keep hearing the term long-term, and a lot of activists and residents say the problem lies in the pipes. In the daily briefing sent to you, it said there's about 15,000 at least of those lead service lines in the city. Does it make sense to recoat old pipes that we hear are decades old, 70 up to 100 years old, and people want relief now?
Yeah, well, I appreciate that. That's why I've said in the past that there's short-term, intermediate-term, and long-term pieces to these goals. Short-term is the water. We've said you should not be drinking the water coming out of the tap. So that's why we're providing bottled water, filters, opportunities for water testing. In terms of next steps, as Director Cray was talking about, let's establish the protocols to know when we can safely say the water out of the tap is safe to drink again. That would be a huge positive step forward, and that would be based on this recoating process. And again, outside expertise validating that. All of us coming together on a consensus basis to say it's the right answer. Longer term, there are lead pipes in the system. Again, where they are, we're still mapping all that. There's a lot of work to be done there. And then you have to figure out what's the long-term infrastructure plan to do replacements of those things.
Governor, isn't the potential for lead leaching, doesn't it outweigh the cost of replacing the entire pipe is what the mayor is asking for? The potential to leach with lead pipes.
Well, again, this is where we're going to rely on outside experts, the scientists, to say, again, we've been drinking, there are lead pipes in many water systems in this state, in this country, that are properly coated. Longer term, though, I think everyone understands we'd like to see those pipes replaced. So it's a combination of both those activities.
Governor, go over here on the right.
Governor, first question. Most of the appropriation that came from the state, this is Joy Reid, sorry, Joy Reid from MSNBC. Most of the appropriation that came from the state went toward the distribution of bottled water. In retrospect, wouldn't that money have been better spent actually dealing with the infrastructure and the lead pipes in the first place? And I do have a follow-up.
Yeah, actually, that's not accurate. It's about a $28 million general appropriation. About $8 million is specifically for bottled water and the emergency resources. That's not the majority. There is a number of other activities, a long list, that include some of this infrastructure mapping, other activities, public health activities, again, to deal with this in a broad setting. And this is not the end of it. I would also emphasize the fact that $28 million is not all the requests we're going to have. This is the request we have in right now that's gotten through the House. Hopefully we'll get through the Senate very quickly this week. And then we're going to move forward with making additional asks as we gather more information on where the appropriate investments are that can really make a difference in people's lives.
And just my follow-up question, you talked a lot about lessons learned, but how those lessons start in your own office, given that the local municipality no longer has the autonomy to decide where its water came from. That decision was made by your office. So doesn't the lesson learned simply start with talking with the emergency managers appointed by you, by your office? And my second part to that is there will be a town hall that MSNBC is having tonight where you could have the opportunity to talk directly to Flint residents. Do you intend to do so?
Well, I'm absolutely focused on solving the problem. That's where I'm spending my time and attention, meeting with the interagency council, doing other events. What I would say is, to the degree there's a town hall that you're having today, it's an opportunity to hear from some of the heroes of this. Mark Edwards, Dr. Mona Hanna-Attisha. And I think it's important that they have an opportunity to share where government didn't work right. So I appreciate you having an opportunity to say that. I'm staying focused, though, on solving the problem here.
Governor, we have exact word count from Donner.
Thank you, Governor. The $3 million that Mayor Weaver mentioned that would go toward immediately relieving residents of what they owe on bills, is that going to be in this current supplemental, or is that going to be in a future supplemental? And is that how you expect it to work?
Well, in the current supplemental request of $28 million, there's $3 million set aside for Flint utility issues. Again, those are resources we'd provide to the city, that we'd partner with the city, and they would go through the process of best deciding how to apply those funds. So again, part of this was to get resources to the city, and there are other pieces of that supplemental that hopefully will also be coming to the city to help address issues within the city, in addition to resources to pay for state assistance.
We're going to go on this side of the room.
Thank you very much, Dave.
Mm-hmm.
Governor, in essence, you're asking people to trust the lead pipes that made them sick, at least for a little while. Is that realistic? And you talk about it being a long-term thing that you're considering. A lot of people consider that to be short-term, get the pipes out.
Well, in terms of short-term, it's a lot of work to take out pipes, to redo all the infrastructure. That's a whole planning process. In terms of near-term, in terms of coating the pipes, this isn't my opinion. This is an opinion we're getting from experts in this field. There absolutely is a trust issue.
Beyond the science and talk about the emotions here in Flint.
Mm-hmm.
And if you don't replace those pipes, a lot of people tell us they're simply not going to drink the water, no matter how many assurances they're given. How do you address that right now?
Well, again, as we go through this process, that's the process we need to be talking about. And that's the point of having third-party expertise, including people that helped identify the problem. Have them be part of the solution. That's why I really admire Mark Edwards, the professor, in his work.
But right now, it doesn't include taking pipes out.
Well, again, right now, the quick thing is, how do you actually get the pipes so they can be safe to drink based on experts, not political people?
Thank you.
Hi, Governor. Hank Winchester, Channel 4 in Detroit. To follow up on the question from MSNBC regarding the town hall, the one thing that we've heard from being out in neighborhoods so much every day is people wanting to see you out in neighborhoods or in Flint homes or with people one-on-one. Why haven't we seen that interaction yet with you and the people that are being affected?
Actually, I have been. I've gone to fire stations. I've talked to a fire station, talked to residents, had discussions. So this is something I do care about. I'm looking to do teletown halls where I can get on the phone to people and have them ask their questions, the citizens of Flint, because I do care about the citizens.
So will that be happening in the short term?
Yes.
Directly from the people?
Yeah. It's already started and it's going to continue. And that's why I'm here today, and I'll be back on a regular basis in Flint.
Steve Carmody.
Steve Carmody with Michigan Radio. What's the status with the federal water infrastructure money that's coming? Have you made a decision about how much of it may come to Flint?
Well, again, we need to go through that process. That $80 million was part of the normal budget process for the federal government, and that was an allocation to the state of Michigan. Part of that's for drinking water, part of it's for clean water. And obviously, we'll work with the city of Flint on making sure they get in the application process and go through that to see what we can have happen in this community.
How long would that process be?
Again, that takes some time to go through that process. But again, we want to work as quickly as possible to get resources here.
This is Robert Allen with the Detroit Free Press, and my question's for Mayor Weaver.
Sure.
And can you tell us, are you saying that residents shouldn't be paying their water bills at this point?
What I have said is that we're trying to figure out why are people paying for water that they can't use, that they haven't been able to use and to drink. Some people have not been paying their bills. The people that are, we thank them because we know we need money coming in, but we've got to figure something out, and that's why I was asking for some money to be set aside to help us with that. And then we will figure out as we get more information from our department how we can work with folks that have already put money into that, what we're going to do for them, because we know that the citizens deserve something. that this has been going on for a while. We're not happy about it, and we shouldn't be happy about it. So that's what we're looking for. I was glad that the governor said these are just first steps, because I'm asking for a staircase. We need more, we want more, and we're working together to make that happen. But we know that people should not and have not been paying for water that they can't use.
Last one, Jim. I'm going to hand you the mic over to Kyle.
Thank you, sir. Governor, this is for you. You're announcing 17 people who are going to come to Flint to help. The mayor said that the city is hiring Mark Edwards. You've been criticized for the use of the NERD fund in the past. You changed it now to 2 funds, moving Michigan forward and celebrating the power of Michigan. I tried to find out who's behind those funds yesterday. Every call I made to board members directed me to call your press office. Do you consider these dark money? They're paying for your 2 PR firms for you to spin doctor this in the public. What about paying these 17 people who are going to spend 3 years of their life helping you solve this? Should they get paid out of those dark secret funds?
Well, again, I don't view them as dark secret funds. These are legal funds. The way I view it is we're getting additional help communicating. And communications is a huge issue in this. It's not about spinning anything. It's about getting the facts to people. And as people know, there's a lot of misinformation out there. So let's work hard on good communication. We've been trying to be as transparent as possible about putting things up on the website, the water test results for residences. We're going to continue on that process of continually enhancing more information so the people of Flint in particular can get the facts and find out the best way to communicate that. And that's where I appreciate the partnership with the mayor and all of us working together to solve this problem.
By way of follow-up and transparent, how much are you paying the 2 PR firms? Well, I don't get a follow-up?